Hi my beauties. Okay, so my YouTube topic for today is going to be hair supplementations and supplements that we can use to make our hair grow thicker and healthier. So I'm using my AirPods because I'm in a house full of kids running around and dogs barking. I think our neighbors are having a party next door, but I feel like if I don't get this content out or film these videos when I can, it's just never gonna happen. So I apologize for that. So just moving along, I wanted to do this topic because a lot of my questions that have come up on my IG lives have been concerning hair supplements. Patients that I see in my clinic every day are always asking about supplements that they can take, or dietary nutrients or antioxidants that they should include in their diet for healthier hair. And the thing with hair growth is that there's so many different causes in dermatology for alopecia. Alopecia is just a term that we use as dermatologists for hair growth, hair loss, thinning of the hair, and there could be a whole variety of etiologies as to why you're noticing these changes in your hair, whether it's more shedding when you take a shower, whether it's more hair shafts on your pillowcase when you wake up in the morning, more hair coming out when you brush your hair, a widening of your part, thinning of the hairline with the little baby hairs that are kind of becoming more dense in the area around your hairline. So these are all kind of signs that there's either breakage or less strength or tensile strength to the hair, or a less hair density that could be happening from a variety of factors. So this isn't a cure-all for every type of hair loss or hair change, because sometimes it's something that's happening internally. So I always recommend, just for everyone to have like a well check by their primary care physician or their family practice doc, just to get their routine labs drawn, just to make sure that nothing is going wrong internally, because your thyroid, your complete blood count, your complete metabolic panel, liver enzymes, kidney enzymes, everything, all these studies are really important to make sure that everything is functioning normally inside and it's not contributing to a hair loss or thinning of your hair systemically, as a manifestation of something going on internally that needs to be regulated or monitored or receiving a higher level of care. So that's kind of my blanket statement that I want to say before moving forward and talking more about supplementations for hair growth. And then first and foremost, I just also want to say that unlike the pharmacology world and in the drug industry, where drugs and medications are put through the FDA and undergo randomized controlled well-powered studies, the supplement industry isn't regulated by the FDA, and it's kind of like the cosmetic industry. We don't have studies and sound peer-reviewed literature to review to document whether we have real changes from these supplements. So most of the supplements that I'm going to be talking about today are supplements that I've either had my patients personally improve with respect to hair restoration and hair regrowth and healthier hair, and just supplements that my colleagues have had great success with their patients for. So most of this data is just anecdotal because we really don't have anything else much to go by. So first and foremost, I think the most important supplement is collagen supplements, which is also good for healthy skin and nails as well. Now the dosing of the collagen can be highly dependent. Sometimes people say 1,000 milligrams a day. There's rare and conflicting evidence, but usually the supplementation will be on the packaging of the product itself. So marine collagen peptides, low molecular weight collagen peptides, are shown to have a benefit in increasing hair thickness, density, and overall hair health, and shifting more of the hair follicles into the anagen phase, which is the growth phase of the hair follicle. So this is one that I recommend. I recommend it for my patients anyway, just for skin benefits as well. And the marine-based and bovine have both been documented to improve hair density and hair thickness and overall hair health. So moving along, another just important component for your supplements just to have healthy hair is just a multivitamin. So multivitamins, contain, hopefully containing all of the B complexes, vitamin B3, which is niacin, which is also documented to be important for hair growth and restoration, vitamin B7, which is biotin, which is a known kind of anecdotal evidence-based supplement that has been shown to grow healthier hair, skin, and nails. And usually you need to use these supplements for at least 6 months, 6 to 12 months, to see almost like a whole year to see the results. But biotin has been shown to be very beneficial too, which I'll get to in a second. But just taking a multivitamin has all the B complexes in it, that has zinc in it. Zinc is usually very helpful, not only topically but orally as well. And multivitamins usually contain kind of a whole plethora of antioxidants and naturally occurring vitamins and minerals, which will be beneficial for hair health. So on the topic of biotin, I also want to take this opportunity to tell you that biotin has been shown to also alter lab results when testing for certain things like cardiovascular abnormalities, congestive heart failure, if somebody's undergone a myocardial infarction, which is a heart attack, thyroid abnormalities, if you have any thyroid diseases, it could obscure that I have my dog right here trying to get out, and I have my 7-year-old rolling around on her hoverboard and squealing. So sorry that this is in the background, but if I try to wait until I have a perfect environment to post, I just will never get around to posting a YouTube video. Sorry. So anyway, so that's important to know about biotin. It really has a lot of health benefits for hair restoration and hair growth, but you have to weigh, the risk and benefit of if you ever were to have a lab abnormality that is misread when undergoing an intake or workup for, chest pain or any cardiovascular abnormalities. That's important to know. So if you have a history or risk of, high cholesterol or any risks for myocardial infarction or heart attack, I would probably say stay away from biotin, just because you don't want that lab abnormality to be obscured. But moving along, oh, thank you. Will you let mommy film this video? This is real life. Oh. And then now that we've listed a couple of the vitamin B vitamins, another vitamin B that's important, vitamin B9, is folic acid. So folic acid has been shown anecdotally to increase hair density and the androgenic phase, which is the hair growth cycle of the hair, with benefit in several studies and anecdotal data. So I think that vitamin B9, so folic acid, vitamin B7, which is biotin, and vitamin B3, which is niacin, all together have proven benefits for hair and are also included in most multivitamins. So if you want to do just a B complex supplement, or if you want to do multivitamin that contains all of 3 of them, I think that would be probably the biggest bang for your buck and very beneficial. Other things that you can include in just your diet or your smoothie in the morning, if you do breakfast smoothies or oatmeal, are anti-inflammatory natural ingredients, which include turmeric and cinnamon. So sometimes I put turmeric and cinnamon in my coffee, sometimes I put it in my oatmeal and in my smoothies, and these have just a natural anti-inflammatory benefit, which helps any condition that is causing a pro-inflammatory cascade in the hair follicle that's causing the hair to shed. So like I said at the beginning of the video, there's multiple reasons why you could be having less hair density, and one of them is inflammation in the hair follicle. So any naturally occurring foods or supplements that can be anti-inflammatory are really, really important too. Ginger's another one. Green tea polyphenols are another one as well. So if you want to include these in your regular diet, or if you want to take them as supplements, those would be helpful too. And another important supplement is saw palmetto. So saw palmetto works by a different mechanism. So when you have androgenetic alopecia, which is alopecia that can happen from changes in hormones, as we get older, male or female, the hormone profiles can change, shift, or alter in their ratios. And so saw palmetto is a naturally occurring supplement that you can take. It's also great for men's like prostate health, but it helps decrease the androgenetic component or hormone etiology for less hair density and hair growth. So that's another great one if you wanted to look into that. You don't have to just be male. It helps females as well. And then also I think a really underrated supplement for hair health is resveratrol. So resveratrol is naturally occurring in grapes, and it's in wine too. So if you want to have a glass of wine for your hair growth, that may not be a bad thing. And it has proven data and evidence to show that it can help be healthy for the hair cells around the hair follicle that produce the keratinized hair shaft. So that's also something that you may look into. So because hair can be very widely with respect to its etiology, causes for different types of alopecia, it's important to know what's causing the problem and to kind of attack it from that standpoint. But these are just supplements that you could take in your everyday life to kind of help with maintaining natural, healthy hair. And then also just remember, for my new moms out there who are just postpartum, telogen effluvium is a very natural, a very common thing that happens. Telogen effluvium happens because while you're pregnant, you keep most of the percentage of your hair follicles in the androgen phase, and then once the baby's delivered, they all shift back to the the telogen and catagen phase where they would have been during that whole 9 months of duration of pregnancy. So you'll have 3 months later a lot of shedding of your hair, you'll have broken hairs in the hairline, and I know a lot of patients that have benefited a lot from PRP injection treatments for stimulating hair growth. PRP has also been really successful in our dermatology literature for androgenetic alopecia as well. So I know we're not talking supplements anymore, but PRP, as far as anti-aging, which I get asked a lot, there's really no proven benefit for anti-aging benefits of PRP, but it has really significant data supporting it for hair growth. So that's important to note too. And then last but not least, this isn't a supplement, but I kind of wanted to include it anyway, just because we're talking about hair and hair health. So minoxidil, which is Rogaine, there's Rogaine for men and women. Dermatologists usually recommend the men's strength because it's just a higher percentage and a higher strength, regardless if you're male or female. But the thing to know about minoxidil is that it is topical. It's Kobe, my dog, just walking by. Sorry, guys. So it's topical, but the problem with it is that you can use it for a prolonged period of time, and it will keep your hair in the anagen phase, in the growth phase, which will decrease the shedding and hair loss. But once you stop it, you're going to lose all that hair that you would have up until that point. So it's hard to maintain. It can also be quite irritating on the skin. It can also cause something called hypertrichosis if it gets on the skin on the face. So if you're putting it on your hairline and it drips on your face, you can have like hair growth on like your forehead or like your cheeks or other areas where you don't want hair growth. So that's important to note too. And then finasteride, just for the sake of completeness, is usually an oral medication that's prescription to help with male pattern baldness, but it has other deleterious side effects too. It can decrease sex drive. It could do a lot of other things that you may want to talk to your provider about first before getting on something like that. So I think just for a take-home message as far as supplements for hair, I would recommend a multivitamin, collagen supplements. Marine-based are probably a little bit better, but bovine are great too. And then also the vitamin B complex, make sure that you're getting that as well. And then, just make sure that you're seeing your primary care provider and getting your lab work done once a year, just to make sure that your thyroid, your kidneys, your blood cells, your liver enzymes, everything is up to par, and your complete metabolic panel is all within normal limits, because that's important too. I hope this helps you guys, and I'll just continue to cover topics that you guys ask me about, because I love engaging with you, and I love to be here as a source of education and resource for you, anything related to dermatology and skincare and aesthetics for that matter too. All right.